Good nutrition is vital for good health, as it is the fuel that drives healthy growth and development. Speaking to our news team at the Nutrition Promotion Workshop was held in Vientiane recently, World Health Organization representative said, good nutrition also drives economic prosperity, as a strong and healthy workforce is the engine of development. Details with Thipphaphone VONGPHOTHONG.
Nutrition in Laos is one of the major health issues, actually. We have to ensure that nutrition is improved, and good nutrition starts with actually the nutrition situation of the mother. So when the mother is pregnant, her nutrition status also impacts on the health and nutrition status of the infant. And it starts when the child is born. And the most important thing at the beginning is to advocate and to promote early initiation of breastfeeding, exclusive breastfeeding for the first 6 months of life, and continued breastfeeding up until 2 years of age or beyond. And in order to do that, and in order to enable a healthy start to life of a child, the mother needs to be protected, and she needs to be supported in terms of breastfeeding, opting for breastfeeding. And we have many situations worldwide where we have aggressive marketing of breast milk substitutes, of infant formula. Actually, WHO has an international code of marketing of breast milk substitutes, which was endorsed in the 80s by the World Health Assembly, and many subsequent World Health Assembly resolutions also encourage countries to enact national legislation to protect, promote, support breastfeeding by protecting mothers from misleading advertisement. So that is one of the key recommendations that we would like to make to improve the nutrition situation in Laos.
Dr. Katrine Engelhardt was speaking while attending the Nutrition Promotion Workshop held in Vientiane recently that good nutrition can help prevent disease for all ages, from infants, children, and adults to the elderly. She said good nutrition also drives economic prosperity, as a strong and healthy workforce is the engine of development.
And another important aspect in rural areas is also to ensure that mothers are encouraged to breastfeed. We don't want to see the promotion of infant formula, especially in rural areas, because children in rural areas are more likely to die when they consume infant formula because of increased risk of diarrhea. And mothers might be diluting the formula because they don't have enough money. So promoting, protecting, and supporting breastfeeding in rural areas is one of the most important things we can do to ensure healthy nutrition in rural areas. And complementary feeding, complementary foods are the foods that children start to get after exclusively breastfeeding for 6 months. So it's the introduction of solid foods to the children. Mothers have to know what kind of foods they can give to the children once they stop breastfeeding. They have to know how to prepare them. They have to be locally available. So promotion of complementary foods, appropriate complementary foods, are very important as well.
According to Dr. Katrine, to enable all children to grow healthily, we need the right policies and investment in place as to make dramatic progress and reduce the number of stunted children in the country in this generation.
For UNICEF Television. For more information, log on to UNICEF.
Of course, as we discussed earlier today during the workshop, improving nutrition is something which needs to be done by all sectors. All sectors need to work together to improve nutrition. It's not only the Ministry of Health, it's the Ministry of Agriculture, the Ministry of Finance, the Ministry of Trade, and the Ministry of Agriculture, just to name a few, that contribute to improving nutrition. Of course, for education, it's important to have nutrition education in schools for children. The Ministry of Agriculture has to ensure that policies are conducive to promoting locally available and healthy food products. Ministry of Trade and Commerce is becoming more and more important because of the importation of processed foods. So we have countries such as Laos, for example, who are beginning to import more processed foods, more sugar-sweetened beverages are coming onto the market, more fast foods are coming onto the market that are very low in good nutrients and are very high in salt, which leads to hypertension, in fat, which leads to obesity, overweight, or in sugar, which can lead to diabetes. So those foods, we have to ensure that those foods are consumed with caution by the people of Laos. We cannot have mothers, for example, feeding young children sugar-sweetened beverages.
A joint campaign supported by UNICEF, Save the Children, Initiative on Biodiversity for Food and Nutrition, and WHO is currently exploring the multisectoral approaches to address food and nutrition security in Laos. Since March, there has been a scoping exercise to review the existing legislation and nutrition laws as a step towards policy coherence to address the problem of malnutrition.
So we have to tell families and caregivers and people that it's important to eat locally available foods, not to eat too much processed foods, which can contribute to rising non-communicable diseases. Non-communicable diseases are diseases that you have for life, that not like infectious diseases that I can give to you or to others, but that you have because of your lifestyle, because of what you eat, because of whether or not you smoke, because of your drinking habits, alcohol drinking habits, and if you are physically active. Those are main risk factors for non-communicable diseases. And the 4 major non-communicable diseases are cancer, diabetes, cardiovascular diseases, and also chronic respiratory diseases. And they can be prevented by eating healthy, by being physically active, by not smoking, and by not drinking too much alcohol.